Okay, so Katie's showing us here the boba wrap. Another common one is the Moby wrap. So we put it on before, and unfortunately the wrap is not quite tight enough. She's a pretty small person. I think the wrap is a little too big for her, but ideally you want baby's knees in line or slightly above hips. And then I'm correcting Katie's posture here. It's a little bit hard for her because Griffin isn't quite sitting correctly, but basically you're wanting to stack shoulders over ribs over hips and do a gentle core contraction. So pulling belly button towards spine as you stand with baby. Okay, next we're going to talk about baby Bjorn carrier, and I'm just tightening the straps here, and this one has an insert for newborn, and then also I'm going to show you with Lydia. She's 2, so she's a lot bigger and probably about to outgrow this one. The last time I wore it with her was when she was pretty tiny, so she's not a super big fan of this one right now, but it's just for show. So I'm tightening all the straps. Basically, you have the top strap and the bottom strap. You really want to make sure that strap around your waist is super duper tight to provide extra support, especially if your kid is a little bit bigger like mine. So she's sitting all the way down at the bottom, and then this is where it gets a little tricky and can be helpful to have someone there to help you, but then that strap kind of tightens around the side. The thing I like about this carrier is that it's super tight. It's really easy to get situated correctly. But yeah, obviously Lydia is not a fan, and her knees are in line with her hips like they should be. This is the Infantino carrier. Again, it's not quite tight enough on Katie, and the thing I don't like about this is, Griffin's knees are way below his hips, so you just want to be really careful about that in carriers. I think if we had tightened it a little bit more, it might have been perfect. He's not a super big fan of this one either, right now especially, but we're looking again at Katie's posture. She looks really good here. Her shoulders over ribs over hips, looking great. And everything is nice and tight, so it allows her to stay stable. This one is the Wild Bird Ring Sling. And Lydia likes this one a lot. I use this one from newborn, and then she fits really nicely in it at 2 years old. So you can kind of tuck the tail in around the side. Lydia really liked this one. She used to nap in it and everything. Again, we're looking at my posture here, shoulders over ribs over hips. I'm showing you the breathing technique right now, diaphragmatic breath and pulling belly button towards spine, trying not to shift my hip to one side, and trying to stay neutral as much as I can. The higher the baby is, the easier it's going to be for you. This one is called the Lily Baby. And this one, I'm going to carry Lydia on my back. It works really well for hiking. It can be a little bit tricky with all the straps, but if you have a second person to help you, it can be really helpful. I'm going to show you here, we put Lydia's leg in wrong at first, so just to show you that piece of it. Again, you want to make sure that bottom strap is super tight because that's going to help disperse her weight and make posture a lot easier. So I'm going to show you here, her leg is going to get moved just right about now. She's shaking her finger. No, hilarious. So we moved her leg. We're going to tighten all the straps again. And she's going to fit a lot better. Her knees are in line with her hips, which looks great. And then I'm going to make sure that I'm not rounding my back or, too far forward. And with babies on your back, you're going to feel like you're falling backward. In the front, you're going to feel like you're falling forward when you're in neutral posture. So make sure you're not rounded. Your shoulders aren't coming forward to support the straps. That might mean you need to tighten them a little bit more. And then the last one we're going to look at is two different, my mom wearing the tush baby, and then we're going to look at Katie wearing it. It does, in the videos, it looks like the tush baby is sliding, but it is really tight and it's not going anywhere. The nice thing about the tush baby is it can be super tight around the hips and it provides a lot of support. You do need your baby to be able to have pretty good trunk control and head control. Lydia has lower tone, and so she really likes this carrier. She likes to be held, and so it's really helpful for my mom when she babysits. This is Griffin in the Tush baby. He's about 6 months old and needs a little bit more support from Katie. So just something to be aware of. I think it's great as babies get a little bit older. He has great head control, so that looks great, but you just want to be careful if you have a baby that's a little bit younger. Has lots of great pockets. It can be nice and tight. The other thing you want to watch for on this one is not pushing your stomach out into the brace. You want to pull stomach away from the brace to contract your core. And stand with that nice neutral posture like we've been talking about. So shoulders over ribs over hips, nice and neutral.